Afternoon, everyone. Thank you for joining. We're going to give it about 2 minutes to let folks get in the Zoom room. And so we'll get started momentarily. In the meantime, if you want to utilize the chat to introduce yourself, give us your name, the name of your organization or company that you're with, and tell us what city and state you're joining from. So we will get started shortly.
Hey guys, just letting you know that chat is disabled, so nobody can type anything in.
Thank you. Thanks for letting us know.
All right.
Good. Thank you. All right. Well, while we work on enabling the chat, I'm going to go ahead and kick us off. So again, good afternoon, everyone. I am Candace Weber, Partnerships Director at the Louisiana Policy Institute for Children. For those who are not familiar with our organization, we are a statewide, nonpartisan nonprofit, and we serve as a source of data, research, and information about the state of early care and education for children birth to 4 in Louisiana. And so we know funding for early care and education comes from federal, state, and local government. And about 2 years ago, in 2022, the Louisiana Policy Institute developed a toolkit, a local funding toolkit, as a resource designed to really help localities in Louisiana understand potential funding strategies so they can strengthen the early care and education systems in their community. We also know how important childcare is for our workforce and the economy. So today we are excited to be a co-host for today's webinar and have conversations with the business community as we learn about public-private partnerships as a funding strategy to support and strengthen the early care and education system in our state. And so I'm pleased to introduce today's moderator for this webinar. We have Chris Massengill. He is the Chief Executive Officer at St. Tammany Corporation. He has held this post since July of 2018. And since that time, the St. Tammany Corporation has announced multiple major business investment and recruitment expansion projects representing over $60 million in capital investment and over 1,100 new and retained jobs. Chris is a strong supporter of early care and education and truly understands the economic impacts and importance of early care and education as it relates to Louisiana's workforce and economy. Chris, thank you so much for being here with us, and thank you for being such an important voice in this conversation. So at this time, I will turn it over to you.
Thank you, Dr. Weber. And let me just say thank you to you and your teammates at the Louisiana Policy Institute for Children. You're such an incredible advocate on this issue. You all are true subject matter experts in this field and such great supporters of what we're trying to accomplish together. So, Dr. Weber, to you and your team, thank you all very much. We all know that our economy relies on a strong and robust child care system to ensure that our parents can go to work and working parents at all levels struggle to find safe, affordable, and quality childcare for their young children. The impacts of our workforce and economy, we know based off of recent studies just here in the state of Louisiana alone, is $1.3 billion annually of the disruptions that it causes to our businesses and industry. The public-private partnerships, we believe, is one way for employers and communities to join together to address the early care and education challenges, as it certainly helps us attract and retain talent. Today's webinar will explore one model of a public-private funding partnership currently being utilized in other states. This model, sometimes called Tri-Share, is a cost-sharing model for funding childcare. In it, the cost of childcare for an individual employee is shared between the employee, the employer, and government partners. The program is entirely voluntary, with employers making the decision about whether to participate. Our two incredible speakers today from Michigan and Kentucky will share more details about the model and how the program operates in their states. Please feel free now, everybody, to ask questions in the chat or raise your virtual hand, and we'll certainly make sure to mark that because we'll have plenty of time at the end of the session for Q&A. So put your questions in the chat, and as they come up, we'll be sure to get to them before the end of the webinar. Well, I'm excited to introduce our first guest, Shannon Garrett, Senior Program Advisor for the Michigan Tri-Share Program. Shannon, thank you for making time for this webinar, and we'll turn it over to you at this time.
Excellent. Thank you so much, Chris. Thanks for having us here today. Really always excited to share about the My Tri-Share Childcare Program. Want to go ahead and go to the first slide there. So I should explain, in Michigan, our abbreviation is MI. We love to call it My, so that everything is My Tri-Share, my children, my everything. So the My Tri-Share Childcare Program, as Chris was saying, shares the cost of childcare equally between employers, employees, and the state of Michigan. It was passed in the state with bipartisan support. It was introduced in our Republican legislature at the time, and our Democratic governor signed it, and it has received continued support throughout the years. And we really look at it as primarily a workforce development tool. So it helps to increase that labor force participation, sustain employment, fostering economic security for families. If you go to the next slide, the brief history. I won't go into it too much, but you can ask questions later. But we started as a pilot program in our fiscal year 21 budget. The budget itself laid out the parameters that it should start as a pilot in 3 regions. That would be an urban, a suburban, and a rural region, so that we could try that out. So when we did the request for proposals, put that out there, picked our 3 regions that comprised 18 counties. And then because it was such an interesting concept, we had a couple of private foundations express interest early on, the W.K. Kellogg Foundation and the Balmer Group. And because of their support coming in to add the sort of stand-in for the state's part of that third, we were able to add 3 more regions. So then, since then, we have been continually supported by the legislature and the governor, and our funding has been increased year over year, so that the last fiscal budget that just passed for fiscal year 25, we are funded at $3.4 million. We do all of this work through regional hubs. So our regional hubs are an organization that is responsible for doing the recruitment and the support through that region, which we define by counties. So currently we have 12 regional facilitator hubs. You can see on the map there, sort of the counties that are covered. The regional hubs are responsible for their counties, but those counties that don't have a hub are serviced right now by our statewide administrative partner. So we're currently in a bit of transition. We're going from the pilot to a permanent home at MyLeap, which is a new department here in the state of Michigan, the Michigan Department of Lifelong Education, Advancement, and Potential, which we call MyLeap. So we're moving into this new home as our permanent place to be running this program, no longer a pilot. And we're also moving changing our model a little bit with our regional hubs. The regional facilitator hubs were responsible for the recruitment and all of the administration of the program, which was gathering all those thirds and putting it together and giving it to the childcare provider. We've decided to take that administrative burden off of the regional facilitator hubs and start using a statewide administrative partner to do all of that behind the scenes paperwork. And that was done through our through a stakeholder-led process to advise us on that. So the next slide is a little bit about how it works. As I said, we have the regional facilitator hubs who right now their primary focus is to recruit employers to be a part of this program, to be that on the ground grassroots face of the program, to be the validator, to say that it works, to work with businesses and employers throughout their region to explain the program, help explain it to their employees, help them identify how many employees they may have that are eligible. We have our statewide administrative partner who processes all of that. So once the employer is in agreement and wants to be a part of the program, then they sign a memorandum of understanding with the statewide partner, who then works with them to do the payroll deduction, to collect the employee's third, and then collects the employer's third and gets the money from us at the state to pay the providers. So it's available to employers of any size, any sector. We don't have any real parameters around that. It's all voluntary, as Chris mentioned. The only real pieces that we want to stress are that everyone has to be located in the state of Michigan. So this is for Michigan businesses, Michigan employees, Michigan licensed childcare providers. The employer can be a national employer, but they have to have a presence, obviously, in Michigan with employees here. We also are very dedicated to ensuring parental choice in childcare. So we do not set this up with slots at childcare providers. We want to work with the employees, the families, either their current provider and get them into the program so that we can have them billing us and getting it all done that way, or helping that family find childcare. And we do that through both our statewide partner and our regional facilitator hubs. And again, licensed childcare options. We see this all as part of the continuum of care in the state of Michigan, so that in order to be a part of the My Tri-Share program, the employee's household income needs to be between 200 and 325% of the federal poverty line. So as I said, as part of the continuum of care, we have our child care scholarship, our subsidy for free or low cost childcare up to 200% approximately of the federal poverty line. Then My Tri-Share picks up at 200% and goes up to 325%. And that's really because the program is geared towards that ALICE population, which I'm sure if you're in childcare, you've heard that acronym before, the asset limited income constrained employed population, that we want to make sure, they're the ones that are most vulnerable in the workforce because of the cost of childcare and because of their income levels. We want to make sure that we're doing what we can to help them stay employed. We can go to the next slide. And so this is just a quick breakdown of what that looks like here in the state of Michigan for program eligibility. We do, for the My Tri-Share program, straight household income as compared to the federal poverty line. It's our child care scholarship, child care subsidy program has a more complex mathematics that they do to see who's eligible. This is just straight household income compared to the federal poverty line. I do want to mention we do have waivers that are available for folks who are under that 200% or over the 325%. For the people who are under the 200%, we really try to make sure and vet them again through our child care subsidy program, because we want them to get what is most beneficial to them first. But if they're still not eligible for that program, then we can waiver them in. And then we can waiver folks in who are slightly over as well. And so again, this is about a workforce development, workforce participation program. So it has benefits to employers with helping them to be able to recruit employees because they offer this, and also to retain the employees that they have. So we're really about removing that barrier for folks, particularly women. This was piloted in the Michigan Women's Commission in the state of Michigan. So there was a special eye always towards being able to help moms in particular stay employed. We can go to the next slide. It's just a employer offering, their perspective on it, that they think that it's really that key point is making it easier to recruit people into their employers. Into the next slide. And so the benefits to the working families might be fairly obvious in that we're reducing their childcare expenses by 2/3 with the employer contribution and the state of Michigan's contribution. Here in Michigan right now, everything is an equal third. So I know that there are some tri-share programs out there that are being piloted in other states and counties that are looking at sliding scales or different contribution points. Here in Michigan right now, it's an equal third across the board. And as I mentioned before, we put parental choice and childcare central to the My Tri-Share program. So again, the only requirement is that the provider be located in Michigan and licensed, either by the state of Michigan or tribally licensed. Neither the employer nor the state can dictate what childcare is used. So we can't say you have to use a center-based childcare or a family-based childcare or home childcare, just that it has to be licensed. And we can go on to the next one. And this is Jennifer. Jennifer shared her story with us about what it meant for her to participate in the program, to be able to, not have to make those decisions about where I'm going to spend my household income this week, because that 66% was taken off of her shoulders. Then we can go to the next slide with the child care provider benefits. Again, we don't dictate where the families send their children for childcare, but we want to make sure that the childcare providers that are participating are receiving the benefit of the program, particularly in timely, reliable payments. There's a lot of ways that collecting money from 3 sources and paying a bill could get complicated, but we have made a commitment to paying those bills within a week. And so that's part of the reason why we went with the statewide administrative partner, to be able to sort of take that out of the state's bureaucracy, so to speak, and put it into a program and an organization that could pay those payments at a timely rate. We also don't set a rate for childcare in the program. Providers must bill at their market rate, so they can't charge more or less for participating in this program. We don't have any requirements around wages that they have to offer or hours or availability or anything like that. It's just, again, that they be located in the state of Michigan and licensed. And our goal really was to make this as easy as possible for providers, because we didn't want to come up with some sort of program that was going to be really great for families and or really great for employers, but then make this burden on providers. We want to make sure that they are not having to have any additional rules or requirements, a simple billing portal, simple timely payments. They send their invoice directly to our statewide administrative partner through their billing portal, and the statewide administrative partner pays that bill, having collected from all the other, all 3 sources. One of the bonuses of the program, just to mention here, is that once childcare providers started having families come to them, participating in this program because their employer was a part of My Tri-Share, childcare providers themselves are now starting to participate as employers. So they offer this as a benefit themselves to be able to retain their employees, because as we all know, childcare providers have very thin, if any, profit margins there. So there's very limited in the types of benefits that they're able to offer. And so this is one way that they can help offset costs for their own employees. The only parameter we have there is that they, again, can't mandate where their employees send their children for childcare. So they can't say, we'll only offer this if you use us. They have to be open to their employees using different childcare. The next slide is our last slide here. Is really just our latest numbers that we had as of May. We're currently seeing a modest growth rate month over month. We expect this to start growing exponentially as our regional facilitator hubs offload their administrative responsibilities to the statewide partner and can concentrate solely, start amplifying their recruitment efforts for new employers. I will say the program did start very slowly. We had employers were hesitant to sign on when this was in a pilot stage, but now that we're a permanent line item in the budget that they can all see, the word of mouth it's starting to spread around the state and we're gaining momentum. So I can get into some of the specifics about the program or some questions, later on. And I think I'll just leave it there for now and see where we go.
Well, Shannon, thank you very much. That was awesome information. I love how you all have really captured this. My Tri-Share, my children. I mean, what an amazing foundation. We all get behind this idea. They are our children, and it's our workforce, it's our business, it's our economic landscape. We're all in this together, and we can solve this issue, and everybody is the better for it, which is why, from economic development standpoint, it's just such a critical issue, becoming more so every day, and one that I believe in deeply as an economic development practitioner. And so congratulations from going to pilot, now being a permanent line item. I know that takes a lot of work, and
Yes.
Congratulations on that, Shannon. And again, thank you very much.
Thank
So
you.
now we get to hear from Team Kentucky. Excited to introduce Andrea Day, Director of the Kentucky Division of Child Care. So Team Kentucky, it's all yours.
Thank you. And thank you very much for inviting us to share with you guys today. After listening to Shannon, I could say ditto to a lot of the things that she has shared, but Kentucky does have a little bit of a different approach. If we could go to the next slide, please. So House Bill 499 was passed in the 2022 regular session. The Chamber of Commerce, our statewide Chamber of Commerce, and the Metro United Way in Louisville were very involved in drafting this bill and getting it passed. $15 million in general funds was appropriated to create this public-private partnership. And again, the state will match the employer's match, but the employer gets to decide what percentage they're paying or what dollar amount. And then we will match that based on the employee's household size and income in relation to the state median income. And again, we saw it as a recruitment and retention tool for not only our local economies, but our state economy. Next slide, please. So here's kind of a timeline of how we approached this. This bill was introduced February 15th of 2022, signed into law. We did a lot of work in the year between the bill passing and the regulation becoming effective, which was a year and a day later that we were able to get that up and off the ground. We did meet with the Michigan Women's Commission to discuss Tri-Share and to really hear about lessons learned. What would they have done differently? What were some things that we needed to think about as far as data, applications, and things like that? We also spoke with Wisconsin. They had a Partner Up program that they sponsored with ARPA dollars. And we also spoke to Florida, who had an executive partnership years and years ago. Just again, trying to cast a wide net because we were creating something new for Kentucky. So we were trying to take all that into consideration. We began taking applications April 2nd of 2023, with the contracts going into effect on July 1st of 2023. Next slide, please. So in Kentucky, we are with public assistance programs. We're a kind of a one-stop shop, and we use what is called Connect. It's the space for individuals across the Commonwealth to connect with Kentucky benefits. And so because this is a widely known resource, we were able to add the Employee Child Care Assistance Partnership Program into the suite of benefits for ease of use and to make it easier for folks to find information. Next slide, please. So who is eligible to participate? Much like Michigan, you have to be in Kentucky. It's to support our workforce and our economy. We use nonprofit and for-profit entities as well as small businesses. One catch here, governmental entities do not participate in this. And at this time, we have received questions like, I work for state government. Is the state going to do this? At this point in time, we're not looking at the public sector as much as we are the private sector and ways to incentivize. 25% of the funds for this program are set aside for small businesses to use. Now, there are some, if we get to the point of we have a waiting list, we've planned for that. We're not there. Slow and steady wins the race. But small businesses, employers who are located in childcare deserts, and then employers who contribute at least that 33% of the eligible childcare costs, those will be priority groups as this program moves on. I say all that, again, it's slow and steady wins the race. We don't have a wait list yet, but we're hopeful in years to come we will. Next slide, please. So this is a lot of numbers here, but this is how we determine our match. So if the family's annual maximum income ratio to the state median household income, if it's equal or less than 100%, we're going to match that 100% of the employer's contribution. Now, we will go all the way down to 50%. We at the state will, regardless, that's the lowest amount we'll go. So we will support those families and those employers in that contribution. Next slide, please. So this is kind of year one, which was July 1st of 23 through June 30th of 24. As you can see, we have 119 families that were approved and that represents 166 children. Now, you'll see we had a lot more applications there. Ineligible employer, that could have been a governmental entity, but in Kentucky, we use our ARPA dollars and we'll be using our Child Care and Development Block Grant funding. We allow on a case-by-case basis that anyone who works in a regulated childcare program across the state, as long as they meet technical eligibility requirements for our federal childcare subsidy, and as long as they work 20 hours a week in a regulated childcare program, their income is excluded from their subsidy application. So we had some childcare providers saying, we want to contribute to the cost of our employees' care. We want to be a part of this. And we were like, come over to the federal subsidy program. We have something that will benefit not only your employee, but you as well. And so if that provision goes away, then we will look at allowing childcare providers to participate in this. But as a state, we are able to support our providers and their employees in a much more cost-effective way for the provider overall. We also had some folks that took the time to fill out an application only to say, I'm not going to contribute anything. And then you'll see here we had 31 families that were denied because they were eligible for our child care assistance program, which was the federal subsidy. Next slide, please. This shows how our state match is going out. In not only the dollar amount, but the percentage. As you can see, we're paying 50% of the match for almost 60% of those who have applied so far. But this, again, this is year one. As you can see, providers are anywhere from $100 to $300 is the most consistent. And then obviously we match that depending on the employee's overall income. Next slide. As you can see here, 28% of those participating are small businesses, which is great because, you know, we do have that set aside for them. We have 63%, almost 64% of the employer contributing at least 30% of the child care costs for their employee. And then also you can see all the different sectors. We are working on streamlining and fine tuning the employer type, because anytime you see that other is such a large percentage as this, we're not capturing what we need to. So we are looking at that to modify and streamline that a little bit more so that we have some more accurate data. Next slide, please. This shows where this is being used across the state. As you can see, we do have some pockets in southeastern Kentucky. Those are banks and healthcare entities that are supporting their employees, but we were very tickled to have such a broad range across 43 counties. So that is huge. Kentucky, to be a small state, we have 120 counties. So for a third to be participating, or that's a win for us. Next slide, please. And then this kind of tells you, this shows you where our families fall across the continuum. The majority of these families are family size of 2, single parent and a child. As you can see, the gross monthly income for the family ranges. And again, these are some families that don't normally fall into any kind of assistance program, but that their employer recognizes that that is a barrier for them and are contributing towards that. Next slide, please. So this gives a breakdown of how our what kind of providers are being used. I will say in the state of Kentucky, regulated childcare, 95% of our care is center-based care, as clearly shown on this graph. We only have one certified family child care home participating at this point. So to be a provider in this program, you have to be regulated, but you also have to participate in our quality rating and improvement system, our quality system. And so here is a breakdown of the levels of quality. Unfortunately, only 35% of our providers statewide are considered high quality, which would be levels 3 through 5. We did see a dip in quality throughout the pandemic because providers were more focused on keeping their doors open and investing any monies that they had into sustainability and just survival. So we are putting more efforts into place to work with our providers to get them to higher quality thresholds. Next slide, please. So what's next? In April of this year, House Bill 561 was signed. It removed the pilot language from this program. So we're very hopeful that because now it's no longer a pilot, it did receive funding for the next biennium, even though it was a less amount, but more realistic amount at this point of $2 million per year over the biennium. We're hoping to continue to grow this program in conjunction with the Cabinet for Economic Development, because they have been tasked with creating and administering a certified child care community designation program. And they're also been tasked with implementing strategies to promote awareness about this program. And I say all that because as a state agency, we know child care. We know bureaucracy, if you will, for lack of a better term. We are not necessarily the most business-minded folks. So really bringing in the Cabinet for Economic Development, bringing in the Chamber of Commerce, bringing in human resource management groups to talk about these things is how we shift our focus from it's just childcare, because, and I use quotations because it really bothers me that people minimize the great work that our childcare providers do every day. They're, I could go on and on about all the benefits of childcare and how it supports the local economy and the workforce participation. But that's where we are right now. We do have the ear of the business community, and they are solutions minded and solutions focused of like, how can we elevate this? So there's a lot of work for us still to do, but we've done a lot of work in a short amount of time. We also launched an online portal this year because the first year we did everything manually. And that really hurts me to say. In 2023, we had to use a spreadsheet that had about 40 columns on it to be able to administer this. But we were able to work with our technology partners and rolled that out this year for the new application window. So we are hoping to, continue to listen to those that have gone through this process with us about how we make this better, taking that feedback and finding ways to market better, ways to inform the public better, not only just our employers, but our families and our providers as well. One thing I would want to, I saw one of the questions when Michigan was speaking about benefit equity. That is one of the key issues that we heard of, well, as an employer, how do I offer this to my employees that have children, but not have something that I can offer to those that don't? That is a real concern. And those are some business decisions that those companies have to make. Do they make childcare part of their overall benefit package that can be selected like you would dental or vision or anything else? So those are some pushbacks that we have received and that we are considering. And again, we will have to rely heavily on our business community to tackle those and to make maybe toolkits to help employers when they're considering joining and being a part of the Employee Child Care Assistance Partnership Program. Our Chamber of Commerce has been very active. They have issued a needs assessment for employers who are thinking about this so that they can do an environmental scan of their workforce to determine, is this something that is this a need? Is this a need that I want to contribute to? So I think even though our success has been very small and very slow, I think, that allows us to be a little more thoughtful, and being able to make this, again, an iterative process, because you don't know what you don't know, especially with new programs. So just being open to have those conversations and to hear the feedback and to consider it and, say, oh, we did this wrong, but let's do better. How can we do that? And to take that lived experience into consideration. Next, I think that's my last slide. So I will open it up. Thank you.
Thank you, Andrea, and thank you for sharing the insights. Another great program highlighting forward-facing problem solution with public-private partnerships. It's also encouraging to hear that your business community really stepped up and was an active partner with you all in what you were doing here, from chambers to economic developers to your private sector. Sounded like they really got on board with this notion. Congratulations on you too, moving from pilot now to a more permanent program. And I think these are two programs that are obviously will continue to be good models across the board. We have some time for some questions. I know that I saw some pop up in the chat. So that's where we will start. Let's scroll back up here. I see one here. Let's see. I saw one come in early. Dr. Weber and Christina, you guys help me to make sure I don't skip any. But I'm going back up. Russell, I believe you had one here. How do you get around the employer having to pay out more for an employee, therefore an employee with a child? Andrew, I think you touched on that a little bit. Shannon, do you have a perspective about that particular point?
Yeah, it's really employer choice on that. We have employers that are taking a variety of approaches to that. Some have figured out what the maximum benefit amount would be that they would be paying out for employees with children to participate in the program, and sort of set that as a benefit level that they're offering to anybody for education purposes. So if you did not have children, you could use that for your own education furtherance. You could use it for your child's education, that kind of stuff there. Some of the other employers that we've heard from have said things like, we consider this similar to like the vision benefit that we offer. We offer vision benefit, but not every employee needs that. Not everyone takes advantage of it. So
Good point.
it's really up to the employers and how they want to roll that out among their employees.
Excellent. Andrew, anything else to add on that? I know you touched on it, but before we move to the next question.
No, like that was one of the first pieces that we got, was like, how do we make this equitable? Because, you know, that's how most businesses are trying to operate now. And, you know, those are some tough business decisions that have to be made.
And Andrew, if I remember hearing you correctly, you all are talking about, or with your business partners, doing some needs assessment. Is that part of that needs assessment as well?
So that was a tool that the Kentucky Chamber of Commerce put out, that needs assessment and environmental scan. Just them coming from the business community.
Got it.
They worked on that for us.
That's a great idea. I know I have a few of my team members listening in, so we're going to put a pin on that. We're going to come back to that idea, Kate, and members of the St. Tammany Economic Development Corporation team, just as a side note. Let me move to Kelsey. Kelsey, I see your question here. Are there any federal tax benefits for employers that participate? Also, are you seeing small businesses participate, or are there lower profit margins making it more difficult for them to cover a third of the cost? Andrew or Shannon, who wants to tackle that one first?
So I think there are some tax implications. I am going to be totally transparent. When I hear the word tax, I kind of just zone out. But our chamber also put together some resources about federal and state tax benefits that could go along with that can be found on the Kentucky Chamber's website.
Excellent.
Yeah, similarly, our Attorney General's office gave us some guidance, either Attorney General or Treasurer's office, I can't remember it right now, but did give us some guidance that we offer. But most of the times we say, recommend that employers talk to their own accountants about what benefits might be available to them through the tax codes.
Excellent. Okay, we have one from Christy. My TriShare, what entities are serving as your regional facilitator hubs? Shannon,
Great
that one's going to
question.
you.
Yeah, so our regional facilitator hubs right now are a variety of types of entities. We have nonprofit organizations, some nonprofit organizations that are regularly in communication with businesses like Goodwill and United Way. We have some nonprofit organizations that also are in the childcare space and provide services to childcare providers. So they're at the table. We have some of our intermediate school districts because they're at the early childhood education space that are serving. And we also have economic development entities. So kind of a variety right now. And we're actually in the middle of a third-party evaluation, doing a pretty comprehensive evaluation across the board of all of our hubs, all of our employers, employees, and providers. And so we're hoping to get some insight from them about how the type of entity is impacting the program overall. So we should have some more updates on that soon.
Excellent. Okay, well, here's one for maybe both of you all can tackle this one. So what specific funding models, regulatory frameworks, and quality assurance measures should be considered to create a sustainable ecosystem for ECE micro centers while maximizing their impact on children's development? Get the notepads out for this one.
That's a lot of information there. But I will say, in the state of Kentucky, you have to be regulated to access any federal or state dollars. So that is why we say you have to be regulated, so that you are being overseen by our Division of Regulated Child Care through our Office of Inspector General. And they're going out and surveying for those health and safety standards and the professional development standards that the Child Care and Development Fund guides us with. The quality, again, that's that kind of ties into all of our providers. I think we have 56 across our state who have opted out of our quality rating and improvement system. So again, we encourage high quality, and that's what we're hearing from our legislature as well, as we want quality environments for children. And the first step is to be part of some kind of system. So again, I don't think that's created any additional barriers to our families or our providers participating, because we saw during the pandemic more providers chose to become eligible to accept federal subsidy. So we kind of had that influx. And so our current structure is set up to support them all.
Excellent.
Yeah, and I would just echo that. I mean, our system is set up for licensed childcare providers. They don't necessarily have to be part of the federal subsidy program to be licensed. So my TRISHARE only requires the licensed part of it. And our licensing program ensures the high quality as part of that process. I will say that it has, some of the early feedback that I'm hearing from this evaluation that we're doing is that there is some concern and some feedback from both employers and employees that don't necessarily use licensed childcare. They use other types of family care or informal care. And so they're not eligible for this program. And so that, is a factor that we need to consider. But I will say too, I try to always emphasize that TRISHARE is not the answer to all of the childcare issues. This is just one approach to try to help parents stay in the workforce. So there's a number of other things that we're doing in the state of Michigan. Governor Whitmer has a number of programs and initiatives happening right now, including incentives and supports for the childcare industry itself, the sector, to try to create more childcare. And my TRISHARE doesn't create centers, doesn't open new licensed care facilities, but it does help show where some of those gaps are, and we can help try to put some resources to those areas to try to grow more availability.
Awesome. Thank you, Shannon. And Andrea, this one's coming to you. This is a question for some clarification about who is eligible for the program in Kentucky. It sounds like an employee can apply directly to the state. Is that right? I want to clear up that.
So our regulation, actually the employer is the one that starts the application process. And I see a question in the Q&A as well that I skipped over in my introduction. The state, our Division of Child Care, we administer this program. There's out of the allocation, 5% from the first year could be used for administrative cost, and then it's 3% in all subsequent years. So it's a tiny, tiny little amount, but we were able to absorb that with some other changes that we've made with our subsidy program that have freed up some other staff to take this on as well. But it's the employer starts the application process saying, yes, this person is employed for me, this is their wage, and that they are willing to contribute, whether it's a percentage or a dollar amount per month. Then the employee fills out the second part, the second page, which is very simple. It's just their household composition, what their earned and unearned income is, and the third page is left for the provider. So that is our contract. Simple, 3 pages. Any entity can terminate a contract, and that's also listed out the reasons for that in our regulation. So again, it's a statewide model. Here in Kentucky, it doesn't have the regional hubs, and that's how the legislation was written. And so that is why we are set up that way, and we're not regional hubs or using a third-party vendor at this time.
Got it. Thank you, Andrea. Hopefully that helped to clear that up. I'm going to go back up to the top here. We see one that may stimulate some good feedback. So this one comes from one of our anonymous attendees. A few restrictions help minimize burden on providers, but may raise risk of private equity and profiteering. Have you seen an influx of private equity in ECE in your state, or do you have thoughts about guardrails as you and other states scale this type of program? Any initial thoughts? Shannon, you want to go take this one first?
Yeah, that's an interesting question. I mean, there's such an investment happening in early childhood education writ
Mhm.
large across the state. I can't really tell, what might be because of my tri-share. I don't think so. But I do see that, we have lots of other public-private partnerships developing around the state. We had some regional childcare planning coalition grants that went out from the state to try to help folks at the ground level bring together businesses and childcare providers and parents and early childhood or child educators together to sort of talk about where the gaps were right there in their own backyards and ways that they might want to develop those. I don't see it as, any sort of big equity firms coming in and trying to do that. I see it as what I see happening across the state are these grassroots partnerships developing. So we haven't really seen that as a concern.
Good deal. Andrew, any thoughts?
No, I would echo what Ms. Garrett just shared. We've not seen any difference yet.
Okay, excellent. We're the last one in the Q&A piece on this section, and I'll come back to the chat. What impact, if any, are you seeing on the child care supply side? How would this work in an area that is considered a child care desert? Who's first?
I'll go ahead. I mean, it is, it still exists. Again, like I said before, TriShare doesn't answer the question, and we don't create the actual, childcare supply. But it does help us to highlight where some of those gaps are. So in those areas where there's not childcare available, our hubs are working with the parents to try to find some slots that might be open either in their backyards or, closer to work or closer to home. But we also have all of the other initiatives that we have happening in the state right now to try to grow that sector.
Excellent. Andrew?
Yeah, and in Kentucky, 60% of our counties are considered childcare deserts, which is huge. But I will say that our capacity is about the same as it was prior to the pandemic. So the fact that we were able to sustain, or if we had providers that were leaving the system, we were able to replace those. And something that Kentucky is focused on is the recruitment and retention of family child care providers throughout the state. We implemented a statewide family child care network. We're going into year 3 with that to provide support and technical assistance to those predominantly women who, they want to care for kids, but they're not thinking in terms of, I'm an entrepreneur, I am a small business owner, I'm impacting my local economy. So our family child care network is really focusing on making them think bigger, making them feel more like a professional, making them recognize that
That's
they are
excellent.
a professional, and also providing them with some strengthening business practice training as well, so that they are prepared for whatever may come their way, and hopefully for longevity and the continuity of care can be a successful small business for the next 20 to 30 years.
If I could just add on to that too, I think,
Please.
Some of what we are seeing in Michigan and I'm sure elsewhere with the childcare sector is that it's really a workforce development issue themselves. So we may have
Good point.
childcare providers that have lots of seats available. They just don't have enough workers to work in them. And so, programs like Andrew was talking about that help childcare providers with their business plans, to set themselves up as entrepreneurs, to try to look at all those details. We also have programs to try to help offset the costs for folks who might be going to school to become early childhood educators, to try to encourage more people to come in the workforce. But I think for both Kentucky and Michigan, the availability of this type of program to be able to offer to your employees as a childcare provider is one of those things that's helping to attract or keep your workforce in place at your childcare provider centers and home-based cares.
Excellent. Thank you both for that piece of information. While we're on the small business topic, Kelsey, thanks for the question again. I I think this is certainly right on point. Are you hearing from small businesses in particular that covering that third of the cost is too much for them to take on? Andrea, I know you all have a set aside in Kentucky. What's been that feedback from small business?
Well, we don't require them to make that third investment. They can choose if they only want to pay $200 a month towards a $1,200 bill. That's all that they have to contribute. We don't require that, 33%.
Well, that's a good clarification. Is that on a sliding scale, or they can just suggest any certain amount and then you all try to fill in from there?
They can choose whatever amount they want to, and then our match will be either anywhere from 100% to the 50% based on the employee's household income.
Got it. Shannon, you have something on that side?
Yeah, I will have a bit more information when we have this evaluation come out, but just anecdotally, I'm not hearing that as much of an issue. I think that small business providers are looking at all sorts of benefits that they can offer. And I haven't really seen the paying 1/3 as a reason so far, at least that I've heard, that small businesses might not be participating. We have businesses of all sizes. And as I mentioned before, our childcare providers themselves, as small businesses, are participating. And I would wager to guess that they make up almost half of our employees that are participating right now. So
wow.
They're all small business
Absolutely
owners. Of course, there's a little bit of different math there. Yeah, I think we're seeing small businesses as well as large businesses.
Okay. Well, Patricia gave us a question talking about, is there anything that discourages home-based providers from participating in either of your programs?
No, as long as they're licensed in the state of Michigan, they can participate.
Same in Kentucky, as long as they're regulated, they can participate. And again, we're hoping that we're going to grow that number as we recruit and offer startup grants for family child care homes.
Excellent. Well, I would certainly be remiss as an economic developer if I didn't dive in a little more about your feedback from your participating businesses. We've heard on the small business side, but I'm really curious about how your economic development community has really stepped up. Are they really becoming an echo chamber for this program? Are they becoming good advocates? And then your business participants, your real true business and industry sector, I'm just so curious to hear your perspective on their feedback about one. It sounds like they were a little, they were testing the waters a little bit when you all rolled out the program, but it sounds like in both of your states now, you've got a good head of steam going with your businesses coming onto this program. Why should they do that?
Yeah, because it's great for their employees. I think that, businesses or employers are really starting to look at, it's so competitive right now for the workforce. And so what can we do to be able to recruit and retain the employees that we have? And so I think when employers talk to their employees about the challenges they're facing, they're hearing that childcare is the number one barrier and the number one reason why people might be leaving their jobs. So I think that they're looking at the cost benefit analysis of that. They're looking at how much it costs to replace an employee who leaves versus how much it would cost to participate in the My TriShare program, and they're seeing this is a much better deal. So they're in it for those reasons. Again, going back to this report or evaluation that we'll have coming out soon, we're going to get some more feedback on some of those points. But again, anecdotally, some of the things that we hear from businesses right now are, could we increase the upper limit? So right now we go up to 325% of the federal poverty line. But one of the things that employers have had to do is increase wages to attract those employees. And so then they might not have employees that are eligible. Employers also don't necessarily know the household income of their employees. They only know what they pay their employees. And so that makes it a little difficult for them to use it as a recruitment tool sometimes, because they can't promise that you'll be eligible to participate because they don't know how much that household income is. So looking at some of those pieces, and then going back to the other feedback I shared earlier around some families not using licensed care, using other types of childcare, and therefore not being eligible to participate. So those are all the pieces that we're looking at as ways to help make this more accessible to more employees and employers.
Awesome. Awesome. Andrew, anything to add as we begin to wrap up?
No, similar feedback here as well, with the exception of we don't necessarily have a cap as far as what the income is. Our match would only be 50%. So again, I think with Kentucky and well, with the nation, childcare has become one of the biggest talking points. And folks are really starting to shift how they think about childcare. It's not babysitting. It's not just
That's right.
kids in a room all day. There's curriculum, there's social emotional learning, there's conflict resolution, there's self-regulation, all those things built in. And so we're now at a critical point where folks are realizing that and talking about that. So one of the things that I've been sharing is maybe don't think about this as it's, oh gosh, childcare so expensive. Childcare is an investment. And it impacts so many other areas, and healthy children, healthy families, healthy communities. That's what we're all striving for. And the earlier we can get interventions in place to give children the supports they need, families the supports they need to support their children, it's just that ripple effect. And kind of gives me goosebumps to think about the potential, but that's where we are right now, is that we can really change the way that people think about childcare. It's not less than anything else, and it is critical if we want our parents to be participating in the workforce and contributing, that we have to start earlier than what we historically have.
Well, listen, you just took my closing completely out. Like, I don't know if I need to say any more than that, Andrea. Let me just say amen, pass the plate, and we drink the Kool-Aid, because I think we all recognize that. We certainly want to be respectful of everybody's time today. Andrea and Shannon, thank you so much for being a part of this panel, again, on behalf of the Louisiana Policy Institute for Children, where we believe a stronger Louisiana starts with successful children. We hope that this webinar certainly has been helpful to you all. We know that childcare impacts employees and employers in our economy, and as Andrea just so eloquently stated, for all of us. But just a couple of housekeeping measures as we wrap up. Please take the time to fill out the feedback survey that you will get. If you have a moment, it'll just take you a minute to do so. We would really appreciate it to hear your feedback. And after the webinar, you'll receive an email from LPIC with a link to the recording of today's webinar, as well as the link to the survey. So again, we thank you. Please continue to talk to your colleagues and government partners and economic development partners about your business's needs as it relates to early care and education. Keep doing what you're doing. Stay safe and God bless. Thank you, Louisiana Policy Institute for Children, for allowing me to be a part of such an amazing conversation today. You guys keep up the great work. We'll see you all soon.